Good morning and good afternoon to my co-host Rose, and good morning to our guest. Good evening to our listeners in America. This is TMS Roundtable. I am Dr. Tovah Goldfine, and I'm so happy to be here on a Monday, Tuesday. Baruch haba, welcome, Rose.
Thanks, Tova. Today we are blessed to have Dr. Hagay Amir. Now, Dr. Amir is a physician, director of a rehabilitation center in Israel. Now, at the moment, the shift is happening with rehabilitation and with chronic pain that patients are addressed in a biopsychosocial approach. In other words, all the other therapists or clinicians are included in the rehabilitation of the patients. Now, this may not have happened to you because your pain was not in a rehabilitation mode, and it may have come on spontaneously, and you haven't had that background. Now, Dr. Hagay will actually take us through the process of what a patient needs to fully recover, so that the psychological needs of the patient are met, the social needs of the patients are met, and the biological needs of the patients are met. And his approach in Northern Israel will give you an expansive idea of the areas you may have missed out on in your own personal care. Welcome, Dr. Hagay, to our little round table today.
Thank you. Thank you. It's a pleasure being here. Although it is a very early
It
hour here
is,
in
but
Israel.
it's something very beautiful about this time, Rose. I'm going to thank you because you've been doing this for over a year and a half, and I'm taking my turn. And thank you, Guy, for joining me and doing my due diligence by getting up at 5.
4.
4.
Yeah,
You're
it's
right.
very nice. Well, I must say that this is a pleasure for me to come here and join you all because I think that the rehabilitation paradigm is very important in treatment, and pain is one of the things. The chronic pain is one of the things that the rehabilitation way, the rehabilitation um, themes that we're working by are very important in the treatment of pain because we're taking in not like most of the other types of medicine that are practically taking a very small part that is not working and trying to make it work. In rehabilitation, we're taking the entire person as a whole. We're looking at what does this um, problem that the person has, how does it affect his being? How does it affect his everyday um, activities, and why doesn't it let him do what he needs to do? And then we're trying to see what can help him withstand that problem and continue his activities and continue his life. We all know that pain, when somebody is in pain, he's almost paralyzed. He can't do anything. It wears him out. He feels like, he can't move. He can't do anything. He's tired all the time because of the pain. The pain just overwhelms him and makes him not want to do anything. It makes him depressed, and it affects his life, and it affects the life of whoever's by him, whoever is living with him, and whoever is close to him is just affected by that pain, and it makes their life awful. And everyone feels it. Everyone that has pain feels it. I remember when I had an awful back pain for months, every step that I made was like running 100 yards, 100 meters. It was so wearing. It was so, it makes you fatigue and makes you just can't do anything. You just want it to go away, and it doesn't, and it's just there all the time. Um, and what we're doing in rehabilitation is we're saying, okay, we'll deal with the pain. We'll do everything that we need to try to ease the pain as much as possible. Sometimes it's possible, sometimes not. But what do you do now? Now we're supposed to go back to our lives. We're supposed to not let the pain rule over your life and stop you from doing everything that you're doing. Because the minute you do that, you become a slave to the pain. And you're afraid of the pain. You're afraid of every minute that the pain will come back. You're afraid that, oh my God, now is the pain is coming, and I can't do anything. I'm paralyzed. And what you have to do is try to find those forces that can help you just put the pain aside and say, okay, the pain is there. What do I do with my life now? How am I going to continue doing what I need to do and live? And this is the most important. And when you're doing that, you need help. You need somebody to show you and to help you how to do that, to know that there's somebody there that will lead you through it, that will tell you, here, you have those forces that can help you withstand that pain and that can help you do your activities and not let the pain rule. You will rule over the pain. It's very simple to say that, but it's very difficult to do it.
Please say it
And
again. I'm just because please say it again. You can rule over the pain because you're not a victim of the pain. And the pain is from inside. And that's where you go inside for the solution, if you don't mind me interrupting. Please repeat that
exactly,
again.
exactly. And you're welcome to interrupt. It's fine. We all have our different views and different um, solutions to this thing, and I think that everyone that suffers from pain might have his own solution to how he does that, because every person gets his force, gets his power, and his energy from a different place. One can get it from within, one can get it from his spouse, one can get it from his family, one can get it from his work, one can get it from a community. Every person gets it from another place. And our job as the rehabilitation personnel is to take this whole team that includes the nurse, the physical therapist, the occupational therapist, the psychologist, the social worker. Everybody together as a team comes together. Everyone can evaluate the person in his profession, and can see how he can help, how he or she, the personnel, how they can help in their field to do this step of going forward, of ruling over the pain and not being ruled by it and being enslaved to it. Because the minute you're enslaved to the pain, you cannot do a thing. You're a slave. A slave is not an owner of himself. A slave is probably the ownership of uh, the owner. Okay, he's just waiting there
For
for
it to
someone to
happen.
follow,
Yeah.
and he's waiting for the pain. He's saying, okay, now what do I do with
Yeah,
this
I'm not
pain?
in
What is this
control.
pain
Something
telling me to
else is
do?
in control. I'm not in control here. Something
Exactly.
else and someone else is controlling me.
Exactly. And this is, I think that the minute it goes into the head of the person that he can control the pain, that he does not have to be ruled by the pain, then he makes the step forward and he can start doing things. He's not scared all the time and saying, oh my God, now the pain's going to come. And he says, okay, now I know the pain's there. I can rule it. I can live with it. It's there, I know, but I have my things to do. I have my role in life. I have to do things in my life, and these are more important than the pain.
Now, tell that to someone who just was told by another doctor that you have to live with this. I can't help you, and you're just going to have to live with this. Because we are not in a fight, but we are in disagreement, or what would you call it, Rose? A different point of view from other
Yeah.
health professionals.
Well, I'm not sure that it's a different point of view. When I'm an orthopedic surgeon as well, and that was my first profession, and I still am an orthopedic surgeon. But when I was practicing, I felt like I didn't have any tools. I knew how to operate, and an operation is not an answer to everything. And sometimes the surgeon says, I can operate, I can fix it, but I'm not sure that the pain will go away. So, what am I doing the operation for? Okay, I want to live, I want to get this pain away. And the surgeon says, well, I'm not sure that that will happen. And I felt as an orthopedic surgeon that I was at loss. I didn't have enough tools to treat people. I knew how to fix things. I knew how to put together puzzles, broken bones and everything that needs to be fixed, I could fix. But sometimes it did not help the person, and I didn't have tools. So I looked for them, and I found them in physiatry and rehabilitation medicine, and in manual therapy, and other tools that I needed in order to help people that an operation would not help them. And that's why I went to and I completed my education in rehabilitation medicine. And it really gives you tools to come and see every problem in all 360 degrees from all around. See the person as a whole, not see the problem as a broken bone, but see what it does to the person. How does it affect his life? How does it affect the life of the people around him? And giving him the power, the energy, the force to be able to come up and say, yes, I have a problem, but I can live with this problem. When an orthopedic surgeon says, well, you have to live with the problem, he doesn't give the person the tools of how to do that.
Yeah.
And what we can do as a whole team, a rehabilitation team, we can give the tools. We can help the person understand his problem, see what he can do, get strategies to go around the problem, and live and do activities and participate in life and go back to his work. And this is the main thing that enables a person when he gives, when he does something for others, then suddenly the pain is not in the center. The center is how he can do things for others and not how others control him. So he's
Yeah.
becoming from a slave, he's becoming the ruler,
Mhm.
the the owner.
Of his
He
life. Yeah.
rules his life. He
Yeah.
can do things for himself. He can do things for others, and he has a role in life, and not just being a slave waiting there for the pain to come.
Yeah. Dr. Hagay, would you mind sharing the difference now with that approach in regard to opioids and the need for opioids when a patient has actually got a framework around them to support them? Could you just talk or share about how the need for opioids are lesser so that our audience can understand that as they go for their opioids that there's an alternative and that alternative is the other people in the team. And unfortunately, many people have missed out on that bigger picture, and they've only got their chronic pain and they don't have those other supports. So can you just sort of share a little bit about the difference it makes to have a social worker having a look at the background problems that the people are dealing with, having the psychologist look at their emotional lives, having the physician and the surgeon looking at the wound and its management, and the ancillary staff um, there to support the doctor. So could you just share a little bit about that to give that sort of sense of encouragement that patients with chronic pain need to actually look further than just the single general practitioner or their doctor, because they may not have the overall strategy for the patient.
Right. I think that being there by yourself, you have to be very, very strong, and it's almost impossible for somebody that is overcome by pain to think of how to withstand it by himself.
Yeah.
And he needs that team to help him or her. Uh, it's not simple because the pain is so ruling and so overpowering, and you must have some help in dealing with the pain. So the easiest way is just to go to the doctor, and the doctor gives you this opioid, and the opioid knocks the pain out, knocks you out, and you're just a zombie. You're just sitting there and taking the opioids, and you're becoming needy more and more for opioids because they stop working at a certain time, and then you need more, and you take more, and you think, great, it helps me, but then after a few days it stops helping, and you need more, and you get into it more and more, and you don't do the right thing. It's like taking uh, a crack in the wall that you see, and you're covering it with mud, and you're saying, okay, now I don't see the crack. The crack is there. The pain, what causes the pain, is there. By covering it with some opioids or by other analgesics will not help, because the pain comes from somewhere. The pain
Yeah.
is much deeper than just the pain and how it affects your body. I think that the pain is usually a symptom of a problem that is much, much deeper. And you have to deal with that problem. Until you deal with that problem, the pain will not go away. And that's why I always see that whatever you do, to some people that have chronic pain, it doesn't help. You're doing things that can block an elephant's pain, and it just doesn't stop it.
Right.
And it comes back
Right.
after a few days. You're dealing with it with some medication or with some injection or whatever, and the pain comes back. Why does it come back? Because it's there. Because the origin of the pain is not the pain. The origin is way inside. The origin of the pain is some issue that is still bothering you. The pain is dealing with this social problem, or dealing with this psychological problem, or dealing with another problem that is just there, and it doesn't let the pain go away, because you need the pain. You need the pain in order to deal with this problem, and you don't understand it. You don't know why the pain is there, and until you don't start dealing with that, and by showing yourself, your inner self, that you are able to live your life with this pain, the pain will not go away. Now, the minute you start dealing with it, the minute you start doing things that show your inner self that it is possible to live and to deal with problems without the pain, then the pain will suddenly seem to go away. It will start to go down. It will start to ease off. and say, okay, I don't need the pain now.
Right.
A pain is something that is caused by so many things together, put together. Pain is perception.
Right.
It's not a feeling.
Right.
It's perception. You can actually close your eyes and see the pain in front of you. Everyone sees it differently. Somebody can see it like fire. Somebody can see it like entanglement of black wires. Somebody can see it as a whole pack of spiders. Every person has a perception of pain in a different way. And you have to change that perception. You have to go to deal with this perception in a different way.
And I want to just interrupt, but hold that note, because when the person is changing their perception, that's chemical. And this is the opioid. And I'm not against medicine. If you want to take an opioid, it's okay. If you want to take an Advil, please. But as you begin to change your perception and work with your therapist or work with your doctor or exercise or get in the water or meditate or journal, which is all chemical reactions from the brain, you become the opioid yourself.
That's right.
So I didn't. I
You
want you
have
to
the
know that.
endorphins.
So it's like this holistic or integrative point of view is you become part of the healing as you were part of the sickness because we're all responsible.
Well, once about more than 100 or 150 years ago, the doctors did not know what they're doing. They just knew that things work, but they didn't know why they work and how they work. Nowadays, in the last 100 years, there was such a leap forward in technology and in chemistry and in biology, and we start understanding the things that we see. We start, well, only a little bit still, but there's a lot more to learn. But we start understanding the chemical things, Tova, as you're saying, that are behind all these actions that happen in our bodies. And we know that there are these internal chemicals that are in our body that we can enlist to do the things that we need. We don't need them from an external place. We can do them by ourselves, by all sorts of activities that we do. Some do it, as you say, by meditation. Some do it by exercise. Some do it by cooking. Just by standing there and seeing the the things broil and smell well, that fills you with endorphins and it's opioids. Basically, endorphins are opioids that you yourself can produce, and they make the same effect. The adrenaline that you get when you're running, the steroids that the adrenal is eliciting and causing your body to be stronger and to be able to withstand other things, those are all chemicals that are inside of you, and you can take charge and you can use them instead of external things that you're just packing into your body with all the effects, the side effects of it, with the blocking of your thought, with the making you drowsy, with not making you able to have any zeal in doing anything. The minute you do it by yourself, then you produce those endorphins, you produce those chemicals that can actually help you deal much better with the pain and with its effects.
Yeah. I think part of what you're saying is enabled by your group of support people, because it's actually finding that space, isn't it, to actually getting out of that bed, to getting off that chair, to moving, and even if it's with a support or whatever, but that support then enables the person for the endorphins to arise or to come out, and then they can do a little bit more. But while the patient feels that they're not coping and that they're hopeless and that there is no hope, they're going to remain in that locked position. And that's why your approach, that psychosocial approach, and the other thing we didn't mention is the spiritual approach, which is very, very important. And probably underneath it all, the most primary important part of rehabilitation, but it's actually, unfortunately, never spoken about. But it's probably the most important thing, that they're loved and that they're lovable, and that that patient can get better, and that the resources, as Tovah said, are within them. And we need the physician, we need the nurse, we need the physical therapist to enable us, the social worker, the psychologist, to enable us to reach that goal. Uh,
You're so right. We just added a great service to our staff. We're dealing now with people that have problems with balance and have problems um, uh, with body parts that are not working, and we know that when you're working with an animal, it can help so much.
Oh my God.
So
yes,
we added dogs, and we're dealing with dogs, and you see the person that can hardly move, that is all the time his face is drooped and he can't say a word. Suddenly we bring the dog to this person, and the person looks at the dog, and suddenly there's a smile on his face, and he starts grooming the dog, and the dog just looks at him with those soft eyes, looks at him with thanks, and it fills him with such joy, and you see the smile on their face. uh People that have been right out of coma, that have been lying in bed and not moving for so long, we suddenly bring a dog to this person, and
Wow.
we put it on his lap, and you suddenly see him smile, and all the people around are clapping and smiling because you see the person smile. So we brought the dogs to heal the soul, not the body. And the minute the soul gets healed, then the body just starts moving. The
exactly.
body starts doing what it needs. So we said, okay, dogs are nice. Let's see what else we can bring. So we brought ponies. We brought ponies with buggies, to put the people that cannot
Oh my
have
God. Amazing.
they cannot have good balance. So we brought the ponies with the buggies. There's special buggies that you can bring the wheelchair on the buggy and strap it in, and then we give the reins to the person, and we tell him, speak to the pony and tell him what to do. Now, the person that has problems with communication, problems with moving his hands and with coordination, suddenly needs to tell the pony, turn right, and call his name. And the pony, his ears suddenly turn backwards when you call her name or his name, and hears the name and hears the command to start going right, and starts walking. And the person is so happy that the pony's moving and starts pulling the reins according to what he wants the pony to do. And you have all the disciplines working together. You have the cognition of where the pony has to go to. You have the communication of speaking and of pulling the reins. You have the work and the control of the hands, and you have the physical therapist, you have the occupational therapist, the communications therapist, and the psychology, and everything put together in one thing. So we just had that put into our services,
Wow.
and,
Wow.
and
Amazing.
it makes such a change in the people. You see them so happy.
That's
You know,
endorphins.
when I started out my residency in rehabilitation, uh, I knew that there's physical therapy, hydrotherapy, there's other things, and I said, okay, I want to see what it is. And by the way, most physicians don't know what physical therapists do, what occupational therapists do. They don't understand that. I think that the only residency that really teaches you about all these allied health um, uh, professionals is the rehabilitation residency.
Yeah.
And And then I went to see what my patients are doing in hydrotherapy. And I went to the pool and I looked and I saw all these patients that are hardly moving. They're suffering and they're getting into the pool slowly, either by a chair that pulls them in, or walking down those stairs and holding the rails and getting into the water. And I see them getting their treatment for 15, 20 minutes. And then I see them going out and everybody is radiant and smiling. And I said, wow, there's something here. I mean, this has to be something special, that everybody that goes in is suffering and going out with a big smile on their face. And I said, I need to study this. So I went and I studied, and I took a course of hydrotherapy. So I'm also a hydrotherapist. And and I and I realized what a wonderful feeling it is to be suspended in the water,
Yeah.
suspended in the water, and letting the water do the
Body
gentle
healing.
work that you need to do. Sometimes it's even not gentle, but you feel it is gentle because you're all engulfed in water, and warm water. It's warmer than the usual warm pool because it's therapeutic. It needs to be higher than 32 degrees, 32, 33, 34. And that's why you can't be in the water too long. You have to stay there a certain time because the water is a little too hot to stay for a long time. So, uh, and you feel it like it's soothing. It's getting all your muscles relaxed,
Mm.
and you can start doing your work inside the water without the gravity, without the pain that it entails to move every arm or every leg or your back or whatever it is that pains. And it's an unbelievable thing. So you have all these things, all these tools that the rehabilitation can give you. You have the hydrotherapy, you have the emotional therapy that that animals can help, that music can help. We have music therapy, we have dance therapy, we have drama therapy.
Whoa.
We did a drama therapy course for people that have problems with communication. Can you
Mm-hmm.
imagine people that have dysarthria and and aphasia and dysphagia, that cannot utter words, are going and giving a drama? Okay, they have to stand there in front of people and communicate and say things, and they do that, and suddenly they feel like what they are doing is affecting someone, is doing something for somebody else. It's not only what they feel, it's what they can make others feel. It's how you project your feelings, how you project your what yourself and your problems to somebody else, and how you help them. There's nothing that makes you happy or happier than you helping someone else. When you do something for another, that makes you happy. That is the chemical uh, thing that happens inside you, that brings out the endorphins, that brings out this serotonin, that brings out the oxytocin, that brings out all these chemicals that make you happy, that make you full, that make your heart be so good and happy with your life. And this is why I tell everyone that comes to me that has a problem, try to find something that you can do for someone else, that you can do for the community. Make that the thing that rules you. Say, okay, now I have a responsibility to do this and that. And I have to do that because now I am in control. Now I can decide what I have to do for others, not for myself. I can do that for somebody else because this is my duty, although I'm in pain, although I am I have an inability or a disability, I can still be strong and control and do for others. And that is something that is so strong and gives you so much empowerment to be able to live through whatever you have.
Mm.
We know that people that are in duty, they can do their duty in any case. I mean, they struggle and they do everything possible because they know that this is their duty. They must do it because somebody else depends on you. It's not you, it's the someone else that gives you the power. And the power comes within you in order to help someone else, and that helps you.
And that's a relationship. And that relationship, Rose and I talk about this, is a healthy relationship. And then you learn to be healthy
Exactly.
with your body, with your pain, with your spouse, with your doctor. And I just want to say something so important to our listeners, because I know I would have thought years ago, well, this is happening in Israel, and I can't get this to me. But what the doctors that Rose and I have met, have worked with that follow Dr. Sarno, that have written books, that have been involved in this movie that I think I told you about. There's now organizations. There's a letter that they write that's free for any patient to hand to their doctor. So I'm saying, some doctors may say, well, sorry, we don't do this, but we are now in a generation to empower our doctor and say, I need help. I need you to partner with me. Can you please find me a pool, a warm pool? And the doctor will be like, sure, I'll help you. Because I think the doctor needs the partnering of the patient. And that's what this show is about. And in Israel, what Marav and I talk about when we had you on. And now, Rose and I have been trying to empower patients that your doctor is also limited. It's not fair to give him the power and then give him the final no. Because what you're doing is not, it may be unusual, but it's happening. Isn't it, Rose? Wouldn't you say it's happening in Australia? If you wanted to find something like that, people could find it. Go to your nurse, go to your physician's assistant. This is not impossible to find in the world. And I want people to realize that this is accessible, this kind of treatment.
Sure, I think that it is, but it's not. It's not everywhere, and doctors don't know. Could I just mention, as Dr. Hagay was talking about service and caring for others, one of the other things that patients need to sort of see, in a way, is when they've done and had an achievement or whatever, or done something really well, like coming out of that pool and feeling refreshed and less pressure, that to remind themselves that later on in the day, when they're thinking about their pain, that they also think about how they managed in the pool, with the therapy, with the therapist, how the therapist was interested in how they managed and how they could actually see the results of the work. Because often when patients have got that loop going on, they can only see the pain and they can't see that underneath that pain is a whole lot of achievement. If you think of a post-operative patient, they've come out of surgery, they've got acute pain, which needs to be managed. But further down the track, they're imagining that the pain isn't going to get better. And I think, as Dr. Amir said, it's probably a good idea to see the achievement and the accomplishment, as he said, later on, as the desire to go to the pain comes on, to actually go to the achievement. Would that be the...
You're so right, and that's much easier now done than 20
Yeah.
years ago. 20 years ago, if you wanted to see something that you did, you would have to have a camera and stand somebody that would take a picture of you and do it. Now everybody has a cell phone. Now everybody can take himself a selfie, or somebody take a movie of what he's doing and how he's coming out and how happy he is and what achievements he can do and how he can walk. And then he can show it to himself
Later on.
afterwards. Later,
Yes.
he can look at it and say, this is what I did, and I can do it again, and it will be there, and it will be better every time. Technology has given us so many tools that have not been there just a few years ago. In my years now, I guess, older than both of you,
No
young
way, no
ladies.
way.
But
No.
in my years, I have seen, going through from working like 100 years ago until technology of today. I've seen an age of advancement. It's unbelievable how we advanced with technology that can help us deal with things that we need.
Yeah.
And it's really an eye opener that you can just take a picture of what you're doing, take a movie of what you're doing, and then look at it. And when you're so down and depressed and saying, oh,
Yes.
the pain is coming back, you just look at it and you see, this is what I can do. This is what I did. This is how happy I was when I came out. And I'm going to do this again. And it's going to happen again, and it's going to be better. You
Each
need to
time.
have that
Yeah.
hope. You need
Improvement,
to
isn't
have
it?
that light in the end of the tunnel. You can see it. Always when people come into my department, they're all broken up after a very bad accident. They were all the bones that were broken and they were put together, and they're brought for rehabilitation. And I come to them and I say, okay, now you're going to be in my department. We're going to help you deal with this. You're going to, in 2 weeks or 3 weeks, we're going to put you on your legs and you're going to start moving. And in 4 weeks, you're going to do this. And in a month and a half, you're going to go out of here with a walker or with a cane or whatever. And they open their eyes and says, wow. And I thought that I'm going to be like this for a whole year, or it'll take me now for rehabilitation a year and a half. And I said, no, it's going to take a month. It's going to take a few weeks, and the pain is going to go away and you're going to feel better. What I'm saying is I'm giving suggestions to the person. In my practice, I also did a course in hypnosis. So
What
I
a beautiful
don't,
combination. Hypnosis and hydrotherapy.
and
Amazing.
surgery and rehabilitation.
Yes, really
So
amazing.
these are tools that I have collected in order to be able to do my job. I have a job to do. I have to be there for my patients. Now, my wife always says, I'm not a surgeon and I'm not a physician. I'm a hand holder. Okay, I'm there to hold the hand of the patient while he's getting better. I'm
Yeah.
there to lead the patient to where he has to go. I'm there to be there for him. And this is what the doctor has to do. He has to be there. You have to give your patient the feeling that you are there. I can't forget the sight of a professor of gerontology that taught us when I was a student. That was many years ago. And we were standing there in a geriatric department, and we saw this old lady sitting in a wheelchair in the department. And this professor goes to her, puts his hand on her shoulder, and tells her, hello, Mrs. So and so, how are you today? And her face lights up. And she suddenly feels much better because she knows, she feels that the doctor is right there next to her, that his hand is on her shoulder, that he's there for her, he cares for her. And that is what you need to make your patients feel. That is what the doctor needs to make his patients feel, that he's there for them, that he understands their problem, that he knows and feels their pain, and that he knows that his job is to be there for the person and to help him through going through this path, this long path that has to be walked in.
True. Yeah. Yeah. And that goes actually for the whole management of a team, really, that the actual people that are within the organization need to have someone above them giving them the hope, if you know what I mean. Like you were saying about the hypnotherapy, actually it's the team management people that need to be like Dr. Amir.
All these people in the team, all the people in the team have this in their inside them.
Yeah,
If they don't have that, they can't be in rehabilitation. They can't be in this team. If they don't understand from within that they're there for the patient and they're giving their lives for the patients, they can't do their work. And
yeah,
they can't stay in working in a place like Loewenstein. We are the people that are working, from the cleaning lady or the cleaning person up until the heads of the department.
yeah. The
They are
CEO
people
even. Yeah.
that every thank you, but they're all people that feel that their job is to be there for the patients.
Mm.
And they're coming there because that's what they understand, and that's what they feel within them, that this is their job, this is their role in life. This is a lifelong role, to be there for the patient, and at any time and at any hour, and they're there all the time. And when I come into Loewenstein, I I get into the gates of the place, and I'm filled with joy that I'm working with such people, with
That's what I mean. Yes.
all the
Yes.
staff that is there for the patient, to do something for others. And this is what gives you life. This is what gives you purpose in life, to do things for others, to be there for somebody else. And this is the main thing that everyone has to cling on when he has a problem. How
Mm.
do I use my powers and my energy to help someone else?
Yeah.
This gives you power. Um, I think that.
Well, I think, Dr. Amir, that you might have a good financial controller at your place as well, that you're able to bring in all these other people that
No,
most
you
rehab
know,
places haven't got.
yes, it's true.
And
And
I
I
think
don't
you've
want,
got a lot of background support that
it's true. But I want
that
people to
others
feel
don't
that they
have.
don't need
Yeah.
to come to Israel, to get this care, that they can talk a little bit about that. Look, the Dalai Lama says, you know how to be happy, to make someone else happy. This is not news. So it's not like
Exactly.
you're talking about something that's bizarre or I want people to realize this is accessible. How can someone do this? They're alone, they don't have support, their insurances run out. Let's just chat for a minute about some realities of some people that I meet on Facebook. And I want to help them because, Rose and I are a little bit like also we want to help people. And we've seen amazing things happen to people that are not Dalai Lama. So talk to us about a person who doesn't maybe have that hope, or you haven't seen in the hospital, or you maybe have met somewhere else. And what have you advised them to do if they can't come to Israel?
Well, you don't have to come to Israel to get help. The help is within you. The help
Well
is how
said.
you perceive your problem and how you perceive your situation. And the minute you perceive yourself as someone in control, and the minute you say, okay, what can I do that can help someone else? How can I help this little cat that I saw right now outside that needs that lost its mother? And how can I make that cat happy? And how can I give it some food, and how I can care for it so that it will be happy? Even that is giving to someone else and not yourself. And that
Mm.
can make you happy. And that can make you feel better and be in control. If you take an animal into your house, that's the least that you can do. More than that, you can decide that you take 1 hour a week, that you do something for others. If you can do it through the internet, if you can do it through a blog that you're writing, if you can do something by going to the community and sitting there and speaking to people that are in need. Every person has something that he can do, and he has to open his mind and say, okay, what is it that I can do? Not what I can't do. I know what I can't do because of the pain, because of the disability, because whatever I have. what can I do? What is the thing that I can help with, that I have the power, that I have the ability to give to someone else? I think this is the main thing, and the one of the strongest things that can make a person better, that can make him cope with his situation. The minute he sees his powers, he sees what he does have and not what he doesn't have. He sees the
Yes.
half cup that is full and not the half cup that is empty. Because everybody has an empty half cup. Everybody. I have it. You have it. Everybody has a little empty space in his cup. Okay. We're human and we're getting older. Okay. We have that empty space there.
Yeah. You know,
But we
as you
don't
would,
have to deal with the empty step. We have to
yeah,
deal with the
yeah,
full step.
yeah. Well, you know, often patients have a dog, for example, and they'll take the dog for a walk. And as you were speaking before, I thought, yes, you know, talking about technology, they could actually take a video of themselves or of the dog as they walk, and then later on, when the pain comes back, they can actually have a look at that joy. Because if you think about talking about cats, you know, like on the internet, you'll see all these cat videos and things that make you laugh. I mean, there's there's
Exactly.
there's a whole lot of ancillary things besides the four walls that people are stuck in if they go there. But they've got to give themselves permission to go there, don't they? And that's
Yes.
often one of the difficulties, isn't it? A person giving themselves permission to have some enjoyment in life, or permission to have those endorphins happening. Yeah, which is sad, really,
Yes,
isn't
but you
it?
have to deal
Yeah,
you have to deal with the inner problem.
yeah.
You have to deal with your fear. You have to deal with your guilt. You have to deal with the problem that is causing that pain.
Yeah, yeah.
And the minute you can deal with the pain by some Advil, by some, I don't know, Tylenol, by something that will make you control the pain and give you a feeling, okay, the pain is under control. I know that I can deal with it. Now I have to do something. Now I have to control my life. Now I have to do something for myself to build up and to sustain what I have within me, so that I'll be able to continue my life, so that I can continue controlling this pain, and uh, uh, and do and do what I need to do in life.
Yeah.
You know, there's a book that I know I have to buy it because I keep quoting it. It's called "The Patient Will See You Now," and I imagine it's about empowering the patient. And maybe that's the next show. I'll have you back in a few months. You know, about empowering this patient. And we're not look. Doctors are human, and they take an oath. And they take an oath, and they're there for you. And it's not always easy. And we, you know, we, and Rose has taught me a lot about. Sometimes we make the doctor our father or our mother, and then it becomes even a more difficult
More
relationship.
complicated.
Yeah, yeah, and right, exactly, Rose. And so, you know, doctors, we need to be in a partner with our doctor. You know, autoimmune chronic pain. The doctor, what are you taught? What, I don't even want to go into that, but you have helped our listeners, and you've helped the show. And I'm going to really, after this taped, let people know that there are answers here. And you know, you're just a regular guy. I mean, I know your wife thinks you're like, you know, King David, but you're a regular guy, you know, with the kippah on, that goes to work every day, that just has common sense. And I'm just, you know, saying, like, for some people this sounds like new age medicine, what we're talking about, and this is common sense. And I want people to feel it.
Absolutely,
It is. Yeah, that's well
absolutely.
said. Yeah.
This is going back to what I said before. The doctors that were 100 years ago, 150 years ago. This is going back to real medicine. This is going back to a medicine of people and not medicine of technology, and understanding the person that you're with and being there for him. This is what it is. It's being the person, the man, the person that is inside is what counts. Not how much you studied and how much you learned and how much you know. Of course, that helps a lot. But not forgetting that you are a person just as the person in front of you.
Yeah.
The patient with you now. This is what counts. Now you are there as a person, as somebody that deals with problems just like the patient. We
Yeah,
have the
and
same
has the
problem.
problems as
We
well.
are
Yeah.
human beings.
Yeah.
And we need to remember that when we're speaking to the patient. And the patient needs to know that of us. We're there. And by the way, you said I'm like King David. My grandmother used to say, "You make your wife a queen, she will make you a king."
This is,
Okay?
I wanted you on for marriage advice. Remember we were talking about that? You will give the best marriage advice. And on that note, Rose has introduced me to some amazing psychiatrists and psychologists and doctors who the first thing that, and medical doctors, that the first thing that they say to the patient is, what's going on in your life today?
That's right.
What else is going on in your life today? Yeah. Well, Karen Neaton, in her recovery room position, says to the patient,
yeah,
when they come out into recovery room and their pain management is through the roof, she says, and what else is happening in your life today? And she'll find out that their children are at home on their own, or that they're going back to an abusive family. She finds out all sorts of things, and all of a sudden the pain goes down and the normal analgesia works. And she gave us a lovely reminder of the patient that came out from a very simple operation, and the anaesthetist couldn't get the pain down, but he had another patient to go into. So he left Karen with a whole list of medications she could give the patient. He came out of the surgery and said, "Oh, where's my patient?" And Karen said, "Oh, she's gone to the ward. She's fine." Because all Karen had asked is, what else is happening for you in your life? Yeah.
This is the beauty of a nurse. This is the beauty of a beautiful nurse, which in Hebrew, it's the same word for sister. The same word,
Right.
sister and nurse.
Yeah.
So beautiful.
So
this is
I think that's what Dr. Amir does to patients. He says, what else is going on in your life when they sit down in front of him? And then he gives them the positive sort of feedback about what they've already done and how far they've come. As you know, he's talking about patients with multiple injuries, like a car accident, for example. They can have fractured femurs, fractured pelvis, maybe what do you call it? Shoulder, whatever, from an accident or a head injury. And then he looks at them and says, you can recover.
Yeah.
You can get better if you follow what we're doing and take on board the idea that you are okay to get better.
In charge.
Yeah.
Mm-hmm.
I mean, the body was made to heal over and over and over again. We know that,
That's right.
Yeah.
So this has been, listen, you have to go to work, and now the sun's coming out, and Rose has clients this afternoon, and it's evening in America, and we're so happy to see some new people that have come to say hello. I'm thrilled that I had you come on, and I'm thrilled to introduce you to my professional partner, Rose, and to have her meet you. And whoa, lucky people in that hospital. And I want people to know that if they have any questions, they can send to TMS Roundtable. We'll ask you if their doctor wanted to somehow speak to you. I'm sure that you would take a few minutes. I've known you to be available.
Of course.
And so this is not like you're accessible, because you're busy holding hands, says your wife. So, Rose, we can say goodbye together, because I don't want to say goodbye, but I know we have to.
Thank you very much. It's during the day for Tovah as well now. Anyone who wants to make any comments or anything, they're most welcome. I'll follow them up, or Tovah will follow them up. And thank you so much for spending this time with us and for getting up at 4 a.m. in the morning and being with us. It's really lovely. And it was
Thank
so
you all.
different.
It's been a wonderful morning.
Yeah.
Have a great
when
day.
When I woke up at 6 o'clock this morning, I felt quite odd having an extra 2 hours sleep.
Yeah. Usually Rose is getting
on
up
a Tuesday morning. Yeah.
Chiming in at night, and it's so nice. And Rose, it felt good to get up. Thank you for the opportunity. Thank you, Dr. Hagay Amir. I'm blessed, and we'll see you next week. Have a wonderful day. Have a wonderful evening.
Okay.
And all of you out there, take charge and
Right.
go do something for others.
Great advice.
Okay.
Great
Thank
advice.
you.